loved ones who have been lost. To characterize those figures in another way, we continue to see the spread of the virus accelerate through North Carolina, but at a much slower pace because people are following the executive orders on social distancing. What we are doing is working. We're saving lives. Our biggest enemy is complacency. The better we can be at staying home through April, the more likely we are able to ease restrictions. We're all looking toward a time when we can loosen these restrictions, and it will come. We have a team examining how North Carolina can emerge with the right practices in place to keep us healthy and strong and ready to jumpstart our economy. We're considering the most effective ways to modify executive orders to help boost the economy while continuing to prevent our hospitals from being overwhelmed with COVID-19 patients. Epidemiologists have been running models on North Carolina's caseload and our hospital's ability to care for those who are sick. These models show consistently that our executive orders work and that wholesale lifting of those orders would be a catastrophe. So we must continue to protect ourselves and our community as the spread accelerates. Today at 5 p.m., my executive order on retailers takes effect. This order will limit the number of shoppers at one time and keep them away from each other so that stores do not become flashpoints for spreading the virus. People need to be able to buy groceries and medicine and other essentials without fear and be confident they can protect themselves from the virus. Many retailers and grocery stores were already using social distancing rules and guidelines for their customers, and I appreciate their efforts to make stores as safe as possible and expect that today's new rules will help protect even more people. And as of today, over 561,000 North Carolinians have filed for unemployment insurance, and over $66 million in benefits have been sent to these people who've suddenly found themselves out of work in the blink of an eye. The Division of Employment Security is continuing to build capacity to take new claims and process checks as fast as possible. I know that every hour counts when you're wondering how to pay rent or buy groceries. And today, our Secretary of the Department of Public Safety, Eric Hooks, will share an update on his department's work to keep our prisons and the public safe during this pandemic. I'll recognize him in just a little bit to say more on this. Over the weekend, and after a virtual Easter church service with my family, I had a few moments for quiet reflection. It's been over a month since North Carolina had our first confirmed positive case of COVID-19. Our state began preparing much earlier in the year, but it is still remarkable to consider everything that has happened in a little over a month. We've added to our own conversations phrases like personal protective equipment, social distancing, and flattening the curve. We're using video conferencing to hold everything from church services to birthday parties. Parents have become homeschool teachers. School teachers have found even more creative and important ways to support their students. But most of all, we are staying at home to save lives. I know many days feel difficult in this new temporary world in which we find ourselves, but please know, when you hit those bumpy spots, that what you are doing to stay home really matters. You probably never even thought about having the power to bend the curve of a global pandemic, but you do, as long as you stay home to stay safe. And to those who can't stay home, our doctors, nurses, hospital staff, grocery workers, first responders, law enforcement, delivery drivers, early childhood educators, sanitation workers, public health staff, farmers, So many of you, even more than that to name. Thank you. Your work has always been essential, but now our entire state is even more in awe of what you do. And we say thank you. Today I'm joined by our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Monica McGee and Nicole Fox are providing American Sign Language. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. Now we'll recognize Dr. Cohen for a few remarks.
Thank you, Governor. I'll be brief today, but it is worth repeating some of what the Governor said. North Carolinians are staying home and saving lives. We're keeping our families safe. We're keeping our health workers safe. We're keeping our community safe. Sadly, our current success doesn't mean that people won't get sick and need hospital care. We are still seeing a slow rise in the number of new lab-documented COVID-19 cases. However, we are in fact achieving our goal of flattening the curve, having fewer people get sick at the same time. Our doubling time of new lab-documented cases is getting longer, and that's a good thing. Even with increased testing, we are slowing the rate of acceleration of new lab-documented cases. And as we learn more from studies and models, the more we know that social distancing is our strongest weapon against COVID-19. This virus is highly contagious and can be spread to people who don't even know that they have symptoms, who don't have any symptoms. As we think about the future, we continue to build our medical capacity so that our hospitals can provide medical care to those who need it. We will continue to aggressively expand the state's ability to ramp up testing, and we will strengthen policies that protect those most vulnerable to serious illness from COVID-19. Staying home now saves lives and puts us in a position of strength as we prepare for the new normal.
Thank you, Dr. Cohen, and now we'll hear from Mike Sprayberry, our Director of Emergency Management.
Thank you, Governor, and thank you for your leadership. Good afternoon. I want to start off with some information on severe weather that we experienced last night and today. As the Governor said, sadly, one person has died in these storms. A Davidson County woman died this morning when a tree fell on her home. Our prayers are with her family and with her husband, who suffered minor injuries. Nearly a dozen tornado warnings have been issued in the past 24 hours. The National Weather Service has confirmed the touchdown of a tornado in Alamance County, and will be investigating possible touchdowns in Anson, Richmond, Onslow, Jones, Craven, and several other counties in the coming days. Flash flooding has subsided in our western counties, but not before leaving washed out roads and mudslides in a few places. Last night, water rescue crews helped people escape from some flooded homes in Watauga and Haywood counties. Across the state, about 148,000 customers are without power at this time. That's down from a peak of more than 286,000 customers just before 9 o'clock this morning. Utility companies expected significant outages from these storms, and they spent the whole weekend preparing. They were able to rapidly surge crews once the storm passed, and they are making good progress on power restoration. If your power is out, here's a few words of caution. Do not run generators inside your house or garage. The carbon monoxide fumes from a generator can be deadly. Stay clear of downed power lines and report them to your utility company. Use flashlights instead of candles for light tonight to avoid the risk of fire. I want to thank our local first responders and emergency managers who are responding to the severe weather while still supporting local needs related to the coronavirus pandemic. They have worked long and hard for many weeks now, and they deserve our thanks and appreciation. The State Emergency Operations Center has now been activated for 35 days for the COVID-19 response. We're continuing to acquire personal protective equipment. Surgical masks and gloves are two items where we do have some supplies, and we are pushing those out to hospitals, first responders, and long-term care homes. All other forms of personal protective equipment remain in very short supply, and we are filling requests in small quantities to meet the most critical needs. Nearly 1,200 medical professional volunteers are screened and ready to work if they're needed to support hospitals. More than 1,000 people are still going through the screening process. Food banks still need your help in keeping their shelves stocked because many out-of-work people are relying on food banks for groceries right now. Please consider a financial contribution or a donation of shelf-stable foods to your local food bank. Visit feedingthecarolinas.org to find the website of a food bank near you. You can give online or in person at a food bank. If you have already contributed, thank you. North Carolina 211 continues to provide critical information for people who need help with food, utilities, and many other needs. Thousands of calls are coming in. If you call 211 and get a busy signal, just wait a while and call back. For twice daily information updates on coronavirus, you don't have to call. Just text COVID-19 to 898-211. You can get texts in English or Spanish. Don't forget to look out for your friends and neighbors and call your loved ones daily. With your help, we will get through this together as one team, one mission, one family. Thank you, Governor.
Thank you, Mike. And now we'll recognize our Secretary of the Department of Public Safety, Secretary Eric Hooks, to talk a bit about our state prisons. Eric?
Thank you, Governor. Thank you for your leadership of Team North Carolina. I'd like to take just a few moments today to recognize the outstanding work of the North Carolina National Guard, emergency management, first responders, state and local law enforcement, and our professionals in adult correction and juvenile justice. This is an unprecedented event presenting a broad spectrum of challenges, and so we are especially thankful to those who work in our correctional facilities. And also in North Carolina, we are determined to meet all of those challenges. One of the significant challenges we face continues to be in the area of adult correction and juvenile justice facilities. In an effort to keep staff and those in our custody safe, the Department of Public Safety has taken numerous steps over the last several weeks to help reduce the opportunity for the virus to spread in facilities. Those steps have been discussed at previous briefings and are listed at the DPS website, so I won't go through all of those today. However, I want to express my thanks to the district attorneys, the courts, and again, local law enforcement for working with us to address specific related COVID-19. I want to discuss a new effort we are initiating to help us reduce the prison population slightly. By law, the Secretary of the Department of Public Safety has the authority to extend the limits of confinement of incarcerated persons, allowing certain individuals to continue serving their sentence outside of a DPS prison facility, but under the supervision of community correction officers. This authority is very limited and has to be exercised responsibly, fully respecting the judicial orders placing individuals in state custody and with the goal of maintaining public safety. In determining who's eligible for transfer to community custody, we are currently utilizing three primary considerations. First and foremost, public safety. We are not considering individuals incarcerated for a crime against a person. Two, time served. The individuals currently under consideration are near their release date. Priority is given to those with release dates in 2020. Third, health risk. Our initial focus is on the older population and those with underlying health conditions. The difficulty is the majority of those over 65 who are incarcerated for serious crimes against a person. With public safety and health risk as a priority, adult corrections has transitioned the first individuals who will continue to serve their sentence in the community. They were pregnant or over 65 with an underlying health condition. All offenders under consideration must meet very strict criteria. Legal requirements, such as victim notification in certain cases, must be met before a transfer to the community is approved. The approximate 500 offenders currently being considered cannot have been convicted of a violent crime against a person, must have a projected release date in 2020, and must fall within one of the following categories. Female offenders age 50 and older with underlying health conditions. Offenders age 65 and older. Offenders already on home leave, and offenders on work release. We're continuing to work our way through lists of individuals to determine whether they have good home plans, whether there are detainers for them, and what their medical needs are. Reentry for individuals can be difficult under the best of circumstances, much less in a state of emergency. People are released from prison virtually every day. In fact, since January of this year, over 6,900 individuals have been released from a prison facility in North Carolina. This is an increase of 10% over the same period last year. In addition to the actions of DPS, the North Carolina Post-Release Supervision and Parole Commission is also reviewing offenders under its authority for possible release. For example, over the past week, the Commission has released more than a dozen pregnant females to community supervision. We're also trying to ensure the safety of juveniles in our care. To do so, we have instituted changes of operations and procedures within juvenile justice facilities, including efforts to bring down the facility population as low as possible. We have heightened efforts to transfer as many nonviolent juveniles as possible from juvenile detention. Some of those efforts include bringing cases to the attention of the detaining judges for approval of release to community-based services, seeking other alternatives to detention for juveniles who committed minor violations of their probation. If the confinement for these reasons was court-ordered, we are requesting the court allow those days to be served at a time following the coronavirus crisis. Extensive increase in the use of electronic monitoring and other alternatives to detention are being taken forward. These efforts have helped bring down the daily juvenile detention population by 25% since the beginning of March, from 2002 to 151 juveniles detained statewide today. We're also working safely to return juveniles committed to longer-term youth development centers to their home communities. Prior to releasing any juvenile from a YDC, staff must ensure the home and community environments are safe and supportive of the juvenile's continued growth. Since March 1st, 9% or 16 juveniles have been released from our youth development centers back to their home community for a step-down based program. For a comprehensive list of actions taken by the department and to learn more about the department, you can visit our website at www.ncdps.gov. Thank you, sir.
Thank you very much, Secretary Hooks. We'll now take media questions, and if you can please announce yourself and press 1 to ask a question, and also tell what media outlet or newspaper you work with. First question.
Our first question is from Ken Smith with WRAL.
Governor Cooper, Ken Smith with WRAL. Over the weekend, we received several emails from concerned parishioners at some churches who were meeting in groups of 10. And when some parishioners questioned that, the pastor told them that the church received some type of exemption from the county. We've not heard of that, and I'm wondering if there's such a thing as churches getting exemptions to have certain meetings. Apparently, they were meeting in groups of 10 and necessarily only family members?
Thank you for the question, Ken. This virus does not discriminate. It strikes when people gather together for whatever purpose, and we have seen evidence of this contagious virus being passed from one person to another in church services, at concerts, at ball games, and this is one of the reasons why that led to the executive order saying no more than 10 people can be gathered together in a place regardless of where it is. So there should be no exemption like you talked about. The only exemption is for a funeral service where the number is still at 50 for a funeral service. What we hope is that people will continue to abide by this order. I know that I participated in my own church's virtual service at Easter with my family at home, and I think a lot of churches are finding new ways to communicate with each other. The services within the building may not be occurring, but these churches are still serving, and we're looking forward to the day when people can get back together physically. And we appreciate people abiding by this order, and I appreciate all the pastors across this state who have worked so hard to warn their congregations about not gathering together like this and to worship in other ways. Thanks for the question. Next question.
Next question is from Ann McAdams with WECT in Wilmington.
Hi, Governor Cooper. Ann McAdams from WECT. And I am wondering, on the economic end of things, we've been in touch with some business owners today. And at what point, from your standpoint, do we hit the breaking point where they can no longer afford to pay their employees without any money coming in? And they, we have learned from people who are filing for unemployment that is far from instant, and there can be quite a backlog before that money starts coming in. So at what point do you hit the breaking point where these businesses may not have a business to go back to if they can't open their doors again?
We know that businesses in North Carolina and across the world have faced a major economic blow because of this virus, and that we know that a lot of workers have had hours reduced or have even been fired from a job as a result of this virus. It's one of the reasons why I signed an executive order expanding unemployment insurance benefits and pushed Congress to pass the CARES Act, which will provide some benefit to individuals and to small businesses. And our North Carolina legislature soon will be coming forward with a package to help as well. We know that staying at home is not sustainable in the long run, but the evidence is overwhelming that right now staying at home saves lives. This order extends through the month of April. We need people the next 2 weeks to really put the foot on the gas and to stay at home as much as possible here in order for us to slow the spread of the virus. We know this virus is going to be with us until there is a vaccination, so it's going to be there for a long time. And when these particular restrictions come off, there will have to be continuing social distancing and people being careful about transmitting the virus. But we know that North Carolina's economy needs to be jump-started, and we know that we have people planning right now about how we do that, working with health experts as to what restrictions that we can ease that would still protect people but help us start our economy. We're talking to people in the business community about how we do that, and so we are working on that now. Our order extends through April, and the better we can do right now in these 2 weeks, the more we can stay at home, the more we can flatten this curve, the more we would be able to ease restrictions going into the month of May. And we certainly look forward to that. Thank you. Next question.
Next question is from Michael Highland with CBS 17.
Hi, Governor. Following up on that, I want to ask what specifically does have to happen for you to get to the point that you would feel comfortable lifting some of the restrictions? And can you tell us what is the process going to look like for reopening parts of our economy that are impacted by this once you feel like it is safe to do so?
So right now our team is looking at statistics. We're looking at the number of deaths and how frequently they are occurring. A lot of families are suffering because they've lost loved ones, and we've had a lot of people go through very difficult times fighting off this illness. We're looking at the number of new cases that are coming about, and we're looking at the trends of hospitalizations and the availability of hospital beds. We're looking at all of those things, and obviously we want a leveling off to the point of feeling comfortable about easing some of the restrictions. And we know that we will have to put in place new executive orders at the end of the month because the ones that are there run out. That's why I'm encouraging people to work very hard during these next couple of weeks to help us flatten this curve and to get these numbers where we want them to get. And we're going to work, and we already are working with the business community, people who work in restaurants and bars, our public schools, people who are getting ready to go to summer camp. We're talking to all of those businesses about where they are, what their capacities are. Would it help you if we eased up on a rule a particular way, and could you still keep a safe business and not transfer the virus but be able to operate and to earn a profit? Those are the kinds of discussions that are going on right now, and we're hoping that these next 2 weeks are good so that we can have some positive results on the kinds of changes that we would make in the current restrictions. But as some people want us to completely obliterate these restrictions, it would be a catastrophe. The numbers are very clear that these interventions that we've entered, the limits on social gatherings, the school being out, limitations on bars and restaurants, those kinds of things, the stay-at-home order, those kinds of things are working. But we're going to take all of this evidence over the next couple of weeks and get all of this input from public health experts and businesses to make determinations of the kinds of things we need to do going into May. Thank you. Next question.
Next question is from Cole Del Charco with WUNC.
Hi there. Governor Cooper, I'm wondering how and if you plan to enforce the new rules for long-term care facilities. Are you going to be monitoring and checking in on facilities to make sure they're following the new requirements?
It is so important that our long-term care facilities take extra precautions to protect their patients because we know that they are confined. And we have put in new rules to add to the ones that we already had in place with restricting of visitors and not having eating in common areas or associating in common areas anymore, isolating people who are COVID-19 positive. I think our long-term care facilities understand the importance of these rules and want to enforce them because they know it's going to reduce the spread in their facilities, which is not good for them. But Dr. Cohen, who's been working with the teams that have been going out to try to assist these long-term care facilities, I'll let her comment on this. Dr. Cohen?
Yes, thank you, Governor. So our both state public health teams and local public health has been working with many of these facilities as well as the associations that oversee this industry. I would say that my department has long overseen the practices that go on in long-term care facilities and hospitals and other provider settings, and will continue to do that to make sure that folks are getting the safe and appropriate care that they should get in these settings.
Thank you. Next question, please.
Next question is from Ames Alexander with the Charlotte Observer.
Yeah. Hi, Secretary Hooks. Can you talk a little bit about how the inmates who are released early under this program will be supervised? Will many of them, for instance, have electronic monitoring devices, that sort of thing?
Yes, sir. Thank you for the question. The actual term, and this is a distinction, they are not being released into the community. We're extending the terms of confinement. So they are still in our custody. They just may not be living at night within our facilities. And so they will be fully under the supervision of our community corrections officers. That may include, that's going to be determined on a case-by-case basis. That will include home monitoring programs, electronic monitoring, and a variety of other ways to keep in touch with them and to make sure that they are adhering to their mandates for carrying out that sentence. If they fail to carry out this program successfully, they will be returned to the facilities.
Thank you. Next question.
Next question is from Andrew Ballard with Bloomberg Law.
Hello, Governor. Thank you for taking my call. Earlier today, President Trump said the decision to reopen states is up to him and the federal government, not the governors. I was wondering if you wanted to react to that.
Well, we want to continue to work with the president and the vice president and the coronavirus task force that the president has put together. We have stayed in constant communication, and thus far, the president has been okay with the governors making these hard calls about protecting the public and issuing these stay-at-home orders. So I would not expect that he would deviate from that, realizing that governors do have this emergency authority under public health. The Center for Disease Control can certainly continue to issue guidance, and we certainly would listen to what the president and his team had to say, but I would not see them deviating from what they have been doing from the very beginning, is to issue guidance and to let governors make the decisions about their own state. Thank you. Next question, please.
Next question is Andrea Blanford, ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. What legal obligation do our businesses, such as grocery stores and other retailers, what legal obligation do they have to inform their employees if another employee is tested positive for COVID-19? If there is no obligation, what is your recommendation then on how they should handle informing employees or customers who shop in these stores? Thanks.
Let Secretary Cohen take that one.
Hi, Andrea. Thank you for that question. So obviously we want to be protecting people's personal medical information. So there is not a requirement for an employer to be sharing another employee's health status with them. What we're asking employers to do, and there is guidance on our website about this, is how to make sure that they're protecting all of their workers as well as any consumers that may be coming into their establishments. So there are guidelines that we'd be happy to share with any businesses that need to better understand if there is a positive patient, a positive employee, what they should then do in terms of cleaning, around social distancing, and around other ways to protect the rest of their employees. So we'd be happy to get you that guidance.
Please.
Our last question today is from Travis Fain, WRAL.
Yeah, thank you, Governor. Travis Fain, WRAL. It looks like from the Department of Public Safety's press release, y'all are talking about releasing early or changing the supervision status early of some 500 people in a state with 35,000 people in the prison population. That's not a lot of people, and I'm wondering, do you see that as a beginning, or is that a top-out figure, that 500 people?
I think that this is a process. I mean, people are being released from prison as they accomplish certain goals and finish parts of their sentences, and they have added on this additional community care for these inmates in order to be able to reduce the prison population. But I'll let Secretary Hooks talk a little bit more about that in detail.
Yes, sir. Thank you, Governor. The governor was right on the money with what he said. We will continue to utilize the framework that I laid out before with public safety and the health of the individuals, and abiding by our judicial orders that we're required to do as part of our framework. We will always continually review our operations, but we will not release anyone unless the risk assessments define for us that we can do so as safely as possible.
We appreciate you joining us today for this event. Please stay safe at home, and particularly the next 2 weeks, we need you to stay at home in order to continue to flatten this curve, and we can continue to work to move North Carolina forward. Thank you very much.